all substance use disorders are very complex diseases.
Americans are more likely to die from an opioid overdose than a motor vehicle crash. Support from the workplace will positively impact the sustained recovery of an individual. To help employers understand what they can do, Dr. Anne-Marie Dale has developed workplace guidelines to prevent opioid and substance use organized around 8 essential elements.
The first element, which is probably the most critical to any program, is to build a culture of care. Leadership must demonstrate support for the program, as well as in supporting the formation of policies and programs that are not punitive and are effective at supporting the workforce. The leadership can model the behavior through storytelling, telling the workers about the program, reasons why they are committed to this program. The more the leaders are genuinely engaged with the workers, the more the workers believe that leadership is truly committed to this program. And it is through interactions over time that a culture of care is built. Upper managers, middle managers, as well as frontline workers must all receive the same communication and must be encouraged to follow a positive, empathetic behavior. The second element is to educate your employees. It is important that all employees are educated in the risks of opioid use as well as the disease of opioid addiction. It's important for the individuals to know those risks to protect themselves if they ever go to the doctor and are prescribed opioids, as well as for their loved ones. But it's also important for them to recognize behaviors on the job site among other workers and an understanding of how to talk to individuals in order to destigmatize conversations around opioid use and other topics such as mental health, alcohol use, etc. Number 3, supervisor training. Supervisors need the basic education provided to all employees. Supervisors need to know how to have that conversation with an individual that might be under the influence or struggling. And it is through training that supervisors may learn what they can and should say and what they shouldn't say, and then also what resources are available in the company that they could offer that individual to use. It's important that a supervisor understands whether the employees perform what are classified as safety-sensitive jobs that would put the employee at risk. They must understand whether the workers need to receive outpatient treatment and the flexibility they need for that, as well as whether a worker who is new in recovery may begin to show signs of struggle. The fourth element is to have a written substance use policy. A written controlled substance use policy must include the intentions of the company related to substance use, which includes their goals. These policy must be clearly written, have enough content that the workers understand what they must adhere to, what is expected of them, as well as how they will be treated should an event occur. Number 5, drug testing program. Many employers choose to include a drug testing policy as part of their written substance use policy, and this is to ensure a drug-free workplace. Terminating an individual as part of their drug testing policy would be viewed as punitive and would further discourage that individual from ever getting treatment. We believe that you should go ahead and offer some sort of treatment as part of your drug testing policy.
Employees who fail a drug test should be offered a second chance to succeed on the test after being provided options and time for treatment. This demonstrates support from the workplace to the employee by offering them ways to keep their job by committing to recovery.
Number 6, healthcare and pharmacy coverage. Health insurance and pharmacy coverage, some of the most important things to consider, first of all, is that the benefit includes non-opioid pain management treatments. Alternative treatments may be physical therapy, chiropractics, etc., that are pretty common and have been shown to be effective. In addition, it's important that an individual is offered treatment for addiction as part of the benefit plan. Employees sometimes must include a portion of the payment in order to show their genuine interest in the process. With regard to pharmacy, it's really helpful if there are some sort of limits put on opioid prescriptions. Under what conditions will a company approve opioid use, reapproval if a refill is going to be necessary with an explanation by the physician. Another pharmacy benefit is coverage for medication for opioid use disorder. The most common treatments here would be buprenorphine or naltrexone. The seventh element is to have an employee or member assistance program. We need an assistance program that actually connects with the individuals in the workforce, particularly these individuals who have substance use disorder and have a need for treatment and engaging with the counselors, delivering in-person presentations to the workforce, providing posters or some sort of communications so that these are familiar faces. The phone number needs to be frequently publicized to the workers. A substance abuse counselor or an individual who's professionally trained in assisting individuals with substance abuse. Employee assistance programs also get involved in the recovery and return to work. They can ensure that the employee remains active in their outpatient treatment. And the last element is to cover all legal regulations that are pertinent, including safety and work accommodation. From the legal perspective, there are probably two laws that are most important to consider. The first one is the Mental Health Parity and Addiction Equity Act, which means you must have mental health resources provided at the same level you provide any physical health coverage. And many employers don't realize that the extent that they must provide those mental health benefits. The second law is the Americans with Disabilities Act Amendment. It requires that those individuals with a substance use problem must also be accommodated if they're recognized as having a substance use problem.
In the workplace guidelines to prevent opioid and substance abuse for the construction trades, Anne-Marie details more about the essential elements and other aspects of creating an opioid prevention program, including background information, needs assessments, and state-specific resources. While the guidelines were developed with the construction trades in mind, these best practices can be broadly applied in other industries. For the guidelines and other resources related to recovery-friendly workplaces, visit healthierworkforcecenter.org.